Good afternoon, everyone. Thank you very much for joining us today. The focus of today's briefing is the new strategic framework for managing and living with COVID through the winter period and into next year. For that reason, my opening statement today is going to be longer than usual, so I would ask you to bear with me, but we will then move after it straight to media questions. However, before I talk about our new approach, let me give the daily report on COVID statistics. The total number of positive cases reported yesterday was 1,401. That represents 20.6% of people newly tested and 8% of the total number of tests carried out. 493 of the new cases were in Greater Glasgow and Clyde, 413 in Lanarkshire, 169 in Lothian and 117 in Ayrshire and Arran. The remaining cases were spread across 9 other Health Board regions. The total number of confirmed cases in Scotland is therefore now 54,016. I can also confirm that 975 people are in hospital. That's an increase of 41 from yesterday. And 76 people are in intensive care. That is 2 more than yesterday. And I very much regret to say that in the past 24 hours, 18 further deaths have been registered of patients who first tested positive over the previous 28 days, and that takes the total number of deaths under this measurement to 2,688. That reminds us very starkly of the devastating impact that COVID can have, and I want again to send my deepest condolences to those who are currently grieving a loved one. The figures I've just reported confirm the trends of recent weeks. In the past week, 94 deaths have been confirmed under our daily figures. The number of people in hospital has increased by over 60%. It has gone from 570 to 975. And the number of people in intensive care has gone up by 50% from 49 to 76. People typically enter hospital a week to 10 days after they first get symptoms of COVID. And of course, they may then need to go into intensive care after that. So unfortunately, given that cases have risen sharply over much of the last month, these numbers for hospital admissions, ICU admissions, and unfortunately a rising number of deaths are likely to continue to rise for some time yet. However, and this is really important, and it's a point I want to dwell on for a moment today, when we look at the most recent data for new cases, we do think we can see some signs of progress as a result of the sacrifices everyone is making just now. And I want to give you a bit more detail of that today. If we turn the clock back 2 weeks to Friday the 9th of October, we can see that in the week leading up to that date, the average number of new cases per day increased to 907. That was an increase of 52% compared to the previous week. In the week leading up to last Friday, the 16th of October, the average number of new cases per day increased to 1,171. That was an increase of 29% compared to the previous week. And today I can tell you that the average number of cases over the past week has been 1,255, which is an increase of 7% on the week before. In other words, cases are still rising, which is why we cannot be complacent. But the rate of increase appears to be slowing down, and that does give us grounds for optimism, albeit it is still at this stage quite cautious optimism. And given the life cycle of this virus, it is likely that the intervention having the biggest impact on helping slow the increase so far is the restriction in going into other people's homes, which came into force towards the end of September. It is probably still too early for us to be seeing the full impact on case numbers of the restrictions on hospitality, which only took effect on the 9th of October. So that effect has yet, we think, to kick into the figures for cases. So we are hopeful that we might see a further slowing, leading to a reduction in new cases in the weeks ahead. Now, I'm emphasising this point because I know that when you hear the daily figures just now, which are all pretty depressing, it's very easy to feel as though your hard sacrifices are not making a difference. But I want to emphasise, and I hope the figures I've just given you do emphasise this, that your sacrifices are making a difference. And it is because we need to keep making a difference that I am asking all of you to stick with it. Let me turn now to the strategic framework that we're publishing today, which tries to set our individual efforts and sacrifices in the overall context of how, as a country, we will seek to manage and live with the virus in the next phase of the pandemic. And let me stress, first of all, that we're publishing this today with an open mind. In the coming days, we will listen to views from stakeholders on any suggested changes they might have or how they would like to see the plan implemented. As part of that process, I'll be convening another meeting with the leaders of other parties this afternoon. Now, I appreciate that many businesses, for completely understandable reasons, would rather not see any restrictions that lead to closure or significant reductions in trade. However, I also know you understand why these decisions are necessary, and we want to give you an opportunity over the next few days to set out any specific proposals you might have. In particular, I know that hospitality businesses, especially hard hit, will want to argue that different types of premises should be open at different levels of intervention. Now, I can't promise that we'll be able to accommodate every request while still suppressing the virus, but I can promise that we will listen. None of us want to be imposing restrictions to businesses or individuals that are not absolutely necessary. Following this short period of consultation, Parliament will then debate and vote on the general framework on Tuesday. Assuming Parliament endorses the framework, we will then take decisions on which levels will apply initially to different parts of the country from the 2nd of November. We'll consult with local authorities and local directors of public health as part of that process and take advice from the National Incident Management Team. And when we set out these initial decisions, we will also set out a rationale for them. The application of levels will thereafter be reviewed on a weekly basis. The second point I want to stress is that although the framework we're publishing today is new, the principles behind it will be familiar to all of you. It's trying to balance different types of harm. It seeks to tackle the direct and very real harm to health and life caused by COVID, but it also recognises the wider health harms that will result if our NHS is overwhelmed by COVID, the social harms caused by lockdown restrictions such as increased isolation and inequality, and of course the economic harm suffered by businesses and workers across the country, which in turn causes physical and mental health problems. None of these issues can be viewed in isolation. We must strike the best balances we can in the interest of minimising the overall harm that the pandemic is causing, not just in Scotland, but in countries across the world. But it is important to stress this fact. If we allow the virus to run out of control, all of the other harms I have talked about will be exacerbated, they will be made worse. So that's why everything we do must be consistent with suppressing COVID as far as we possibly can. I'll now set out in summary the 5 levels of intervention we are proposing, depending on the rate of infection nationwide or in different parts of the country. I'll then talk about our wider work to make it possible to live with as few restrictions as possible, for example, by continuing to strengthen Test and Protect, improving compliance with the facts advice, and working with business to create as safe as possible an environment for staff and customers. And lastly, I'll touch on the financial support we will provide for businesses directly affected by restrictions. Firstly, the levels. We're proposing today 5 levels of possible intervention. This will allow us to take a national approach if required. It is possible that the whole country at some point could be placed in the same level. However, it also means that we don't have to take a one-size-fits-all approach if that is not warranted. It means that a part of the country with low rates of infection won't have to live with the same restrictions as a part of the country with much higher rates. And this approach also allows us, while retaining some flexibility, which we always need in the face of an infectious virus, to give you a better idea of the restrictions that will apply at different levels. Now, I don't have time to go into all of the detail right now, but you can go to gov.scot, the Scottish Government website, and look at the framework for yourself. The table at the end of the document that we're publishing today sets out the levels in detail. However, broadly speaking, our proposed baseline level, what we have called level 0, is the closest to normality that we think we can safely get to without more effective treatments for COVID or a vaccine against COVID. And remember, we are hopeful for both of these developments in the months ahead. Level 0 is broadly comparable to the position we reached in August when the virus was very suppressed in Scotland but still a threat. At this level, we would be able to meet indoors with 8 people from 3 households, and most businesses would be open, albeit with safety measures in place. Level 1 sees slightly more restrictions. For example, indoor household meetings would reduce to 6 people from 2 households, but there would still be a reasonable degree of normality overall. And I would describe that as broadly similar to the situation we were at in Scotland around mid-September, as cases started to rise again, but prevalence was still fairly low. Now, getting back to level 1 and then to level 0 and being able to stay there is what we are aiming for this side of better treatment or a vaccine. However, levels 2 and 3 are intended to apply at times such as now, when transmission is higher and rising. Level 2 entails restrictions broadly similar to those currently in place just now outside the central belt, so limitations on hospitality and no gatherings inside people's homes. And level 3 is broadly similar to the tougher restrictions which currently apply across the central belt, with much of hospitality being closed completely. There are, however, some key differences. For example, we envisage restaurants being able to open at least partially in level 3. Levels 2 and 3 are intended to apply, if necessary, for relatively short periods of time to bring transmission down and under control. And finally, level 4, the highest level, which of course we would not use unless absolutely necessary, would apply when transmission rates are or are threatening to become very high, with corresponding pressure on the NHS and perhaps the risk of the NHS being overwhelmed. The restrictions at level 4 are closer to a full lockdown. For example, non-essential shops would have to close at level 4. However, even under level 4 restrictions, 6 people from up to 2 households could still meet outdoors. There would be no limit on outdoor exercise for individuals, and we would seek to keep manufacturing and construction businesses open, albeit with safety measures in place. In other words, we do not envisage returning to a situation as severe as the first lockdown imposed back in late March. And I hope that helps to reinforce an important point. We are not back at square one. We have made progress in tackling the virus, and we have more tools now at our disposal to help control it. And today's framework will help us, I hope, to make further progress. I can also confirm that our objective at all levels is, as far as possible, to keep schools open, though with necessary safety measures in place. That is, in our view, in the best interests of children and young people. So that is a summary of the proposed levels. You can read the detail online, and we will consult with stakeholders and make any necessary amendments ahead of Parliament debating it on Tuesday. Before I move on to my next point, though, I want to say something directly to people who were shielding up until the end of July. Anyone who was shielding should, as a minimum, follow the guidance we provide for the general population. That in itself offers a substantial degree of protection. But today's publication also provides additional advice for each level of restrictions, for activities like going to work, school, shopping and having contact with others. You will find this in the framework document itself, and the Chief Medical Officer will be sending you a letter today. You can follow this advice to the letter if you want to. However, if you want to understand the evidence and take more informed decisions, we will shortly be publishing a guide to help you do that. And if you need practical assistance, remember that the National Helpline remains open for advice and support. The number is 0800 111 4000. We know how hard the last few months have been for everybody, but particularly for those in the shielding category. So we are determined to give you the advice and support you need to stay safe and well. Now, for all of us, including those in the shielding category, our aim must be to live with this virus under the fewest restrictions possible. We want to get to and then stay at level 0 or level 1 of the framework. And the good news, which we should all hold on to, is that we know this is possible because we got there back in the summer. It depends on all of us following all of the rules and advice and doing all that is asked of us. But it also depends on government putting all of the right supporting systems in place. So as well as setting out the levels of intervention, the strategic framework sets out how we will support compliance with facts and other rules. This includes support for self-isolation, which is a crucial part of Test and Protect. We also set out our further planned increases to testing capacity. Before the end of this year, we will have capacity in Scotland to do at least 65,000 tests every day. Some of the increase in capacity will come from the UK-wide Lighthouse laboratory system, but most of it will be in the NHS Scotland laboratory system. We've also published a paper today with recommendations from our clinical advisors on the best use of this extra capacity. Our top priority must always be ensuring that we can quickly test people with COVID-like symptoms, and we know that demand for that will increase over the winter period. Beyond that, our clinical advice is telling us to focus on protecting those most at risk from COVID. We already do regular testing of care home workers, but I can confirm that we will move now to introduce regular testing of designated visitors to care homes, to NHS staff who visit care homes, to care at home workers, and to anyone who is admitted to hospital in an emergency. This is an approach designed to reduce the risk of COVID spreading in the settings where we know it can do most harm. However, we will also extend testing of asymptomatic people for surveillance purposes and to help manage outbreaks. In addition to strengthening Test and Protect, the strategic framework sets out how we will support vulnerable people through the pandemic, and it details our ongoing work with different sectors of the economy, such as retail and hospitality, to ensure that shops, bars and restaurants are as safe as they possibly can be. As part of that, we are considering giving more powers to environmental health officers and trading standards officers. The vast majority of businesses have gone to great lengths to comply with regulations and ensure the safety of their staff and customers, and I am hugely grateful to them for that. But it is only fair to them and to the public more generally that we take effective action against the small number who don't take the rules seriously. The final issue I want to cover today is support for business. Our objective is to get the virus to low levels again so that we can live with as few restrictions as possible and allow businesses to operate as close to normal as possible. But we have to be realistic. In a global pandemic, some restrictions on business are likely to be necessary for a while to come. And at times, like now, these restrictions might require some businesses to close or to limit trade significantly. We hope such periods will be short, but it is essential that we support businesses through them. And the Scottish Government will do that to the maximum possible extent within the resources we have available to us. I can confirm, therefore, that no matter what level we are at, the following support will be available, and let me stress that this is over and above support available through the UK-wide job support scheme, which of course we think should go further. Businesses which are required by law to close will be eligible for grants of either £2,000 or £3,000, depending on rateable value, for every 4 weeks that they have to remain closed. And businesses which can remain open but can't trade normally due to restrictions will be eligible, again depending on rateable value, for grants of £1,400 or £2,100 for every 4 weeks that restrictions limiting their trade are in place. This support package matches that was announced by the Chancellor yesterday for businesses in England. Businesses in Scotland deserve nothing less. But there is one point that I am duty-bound to make today. The Chancellor's commitment for England was open-ended. He will pay whatever the demand from business is for as long as necessary. I think that is right and proper. He is able to do that because he can borrow the money to pay for it. The Scottish Government can't do that, so we have to rely on the Chancellor to provide the same funding guarantees to Scottish businesses as he already has for those in England. So far, that hasn't been done. Not a single penny of extra funding beyond that already allocated has been guaranteed for Scotland as a result of yesterday's announcement. So while I am not prepared to offer businesses here less funding than their counterparts in England will get, I have to be clear on this point. Without a resolution to the problem I have just highlighted, the money the Scottish Government has to pay for these grants will eventually run out. When exactly that will happen will of course depend on demand, but it will happen. It is not possible to fund indefinitely demand-led commitments out of a finite budget with no powers to borrow. That is why we need a resolution, and the Scottish Government will be pressing for that resolution as quickly as possible. Now, I have encouraged everyone to look at today's framework because it is a document that for the period ahead will affect all of us at some times and in some ways. However, the success of the framework will also be affected by all of us, by what we do and how we behave. Government must and will take a lead in tackling COVID, but all of us have a role to play. I know that after 7 months, with the clocks about to go back and talk of restrictions over Christmas, it can be very easy to get discouraged and downhearted. I understand that, I share that. But I want to end with 3 reminders that I hope might help all of us. First, never forget that we are not powerless against this virus. It feels like it, but we are not. All of us retain control and some agency as individuals. None of us can guarantee that we won't get COVID or pass it on, but we can choose, all of us, to act in a way that makes us safer as individuals and which also protects our loved ones and our community. Facts sets out the 5 basic ways that help us to do that. So remember to wear face coverings because you doing that protects other people and other people doing that protects you. Remember to avoid crowded places, especially indoors. Remember to clean your hands and surfaces. Remember to keep 2-metre distancing from people in other households to reduce the chance of transmission. And remember to self-isolate and get tested if you have symptoms. Secondly, remember that now more than ever, all of us need to look out for each other. So let's all of us try to do that. Be kind when people around you are feeling a bit down or feeling just completely scunnered. We all have days like that. And we know that some people, because of their particular circumstances, will be finding it much harder than others. So offer help if you can to people in need. Sometimes even just a smile or a kind word helps. Show empathy, solidarity and love for each other. We need these values now more than we have ever done before. And finally, never forget that we will get through this. Right now, this all feels terrible, and it is terrible. And it feels never-ending. But humanity has gone through worse. You know, some of you watching right now, though a diminishing number in our country overall, remember the horrors of World War II. That wasn't 1 year or 1 Christmas without normality. That was 6 long, brutal years during which many didn't know where their loved ones were, or at times whether they were dead or alive. What we are going through right now is hard. It's harder than most of us have ever known, but we will get through it. This will pass, and before too long, we will be looking back on it and talking about it in the past tense, not planning for how we will deal with it. But until then, let's help each other through it as best we can. Let's stick with it because we know the sacrifices we are making can and are making a difference, and let's stick together. By doing all of that, we will protect each other, we will protect our National Health Service, and ultimately we will save lives, and that is what it is all about. Thank you again to all of you for everything you're doing. Thank you for listening today. Please stick with it. I'm joined, as you can see, by Dr. Nicola Sturgeon, the Deputy Chief Medical Officer today, who is going to take questions with me now. But given that my remarks there were longer than normal, for reasons I hope you will understand, we're going to move straight to questions. The first question today comes from Ewan Petrie from STV.
Thank you, First Minister. We've had 4 phases of a route map, 16 days of restrictions that then was extended to become 23, and now this 5-tier system. I'm sure people appreciate it's a rapidly evolving situation, but can you understand the confusion and frustration at the changing guidelines, and what makes you think this strategy will provide more clarity?
Of course, I understand people's frustration, confusion, and just general despair at what we're living through right now. I don't just understand that, I share that. I'm the First Minister, but I'm also a human being. I'm a citizen of the country. All of the rules and regulations and restrictions apply to me just as they do to everybody else. We are all feeling these things just now. This is a global pandemic, and the other thing we've got to remember is it's not just us feeling all of this. Look across the UK, Europe, the world right now, and literally every country is going through something similar to this. That doesn't help us feel better on a day-to-day basis, but it is an important point of context to remember. Second thing I would say, And I've set this out in a little bit of detail today because I think it is important to underline this. The figures that I report on a daily basis right now are depressing. They're depressing for me to report, they're depressing for you to listen to, and they are particularly awful for people who are directly affected. But we do think, as I said before, that the sacrifices we are making a difference. Cases are still rising, but the rate of increase is slowing, and that is down to what everybody is doing. We think that is mainly down right now to the fact that people are not going in and out of each other's houses, and we think we will see an even bigger impact as the restrictions on hospitality take effect. So don't feel that this is hopeless or pointless. It is hard, but it is making a difference. And lastly, given what we face right now, it's important that we continue to adapt our approach for different phases of this. The route map served us well as we were coming out of the first phase and driving levels very low. But as we've gone into the next phase, as much of the world is doing right now, it's important that we adapt that. And one of the things that's important to do is make sure that as long as we live in a period where some level of restrictions might be necessary, which is going to be the case until we have a vaccine or better treatments, then we do that in a much more targeted and proportionate way. As I said earlier on, there may be points where we have to apply the same level of restrictions nationwide. But if we don't have to do that, we shouldn't. We shouldn't have, say, the Highlands living under a level of restriction that is designed to deal with higher rates of the virus in the Central Belt. So this is about being more proportionate, more targeted, and having an approach that says we need the level of restrictions necessary to control the virus, but we don't want any level of restrictions that are more severe than they need to be. So I understand people's feelings. This is a global pandemic. It's, I hope, once in a century, even more than that. We just happen to be the ones, unfortunately, living through this right now. It's hard, it's tough, it's depressing. I know that, but we have no alternative but to stick with it and acting together in the collective interests of the country, get ourselves through it, and the government will do everything we can to lead us through that in the best possible way. Nicola, do you want to add anything?
Only a couple of very minor points, really, in addition to what the First Minister said. And I think the first of this is that we completely understand people's confusion and frustration. It's very difficult in a moving landscape. But that's exactly why the strategic document is as detailed and as comprehensive as it is, and lays things out as absolutely transparently as we possibly can, in as much detail as we can, so that people do have that clarity and can refer to it pretty much all in one place, and I think that will help. And just secondly, I think one of the things that people have found most difficult to deal with, and certainly I personally have found difficult to deal with, again, as a human being, is the uncertainty that we feel with this pandemic as human beings. And I think, again, the strategic document with the levels gives people some sort of idea about what their lives may be like as they go through the different levels, depending on the level of infection where they're living. So I think it gives people some ability to know what might be coming in both directions, whether we have to scale up a level or down a level in a particular area. So I'm really hoping for all of us that this helps to alleviate some of that confusion and frustration, which is understandably felt.
Thank you. Claire McNeill from ITV Border.
Thanks, First Minister. First Minister, in the ITV border region, we've got people who cross the border on a daily basis for work or to see family. Firstly, can you tell us what the reasons were for the Scottish Government implementing a different tier framework to the one in England, and why that three-tier system wasn't deemed sufficient? And secondly, do you think the different systems might cause confusion or extra difficulties for those who do have to cross the border regularly, and is there anything you can say to reassure those people at this point that they're not going to be kind of caught between the two?
Let me take both of those points in turn. The 5 levels that we set out today, I ran through the rationale for this earlier in the week before obviously we set out the detail. So our 5 levels, the middle 3 are broadly, not identically, but broadly equivalent to England's 3 levels. We've decided we need one at the bottom and one at the top for reasons I set out before. England's first level, which they call medium, is a very high level of restriction. We think actually we need to have one that we're aspiring to get to, which is a a much greater level of normality, not as some unattainable aspiration, but as something that we know can be done because we got to that kind of level in the summer. So I think it's important that we do, all of us know that we want to work towards a greater level of normality than would be encompassed in that first level of England's. And we need one at the top, because the day the Prime Minister outlined England's, his Chief Medical Officer said that he didn't think the top level in England's tiers was necessarily enough in all circumstances. So it may be that we have some circumstances where we need to go above that. So we set out a level which, you know, it is, I suppose, the level the whole of Wales goes into today, and pretty much all of the Republic of Ireland is already in, which is something closer to complete lockdown. We don't want to get there, but if we need to, it's important that we have that. And I think it's important to set that out from the lowest level to the highest level in its entirety, in the interest of giving people as much transparency and certainty as possible in a deeply uncertain context. So that's the reasons. It's not about trying to be different for the sake of it. It's about taking the core of England's and then sensibly, and in my view, I think logically, adding to that so that it gives us something that covers the range of scenarios we might be faced with. And secondly, you know, everybody's having to forget for a second the border between Scotland and England. Right now, I live in Greater Glasgow and Clyde. The advice I have to live by right now is that I can't go outside of Greater Glasgow and Clyde, apart from essential purposes like coming to Edinburgh for my work. But I can't, you know, when I go home for the weekend, I can't then travel to see my mother and father who live in Ayrshire and Arran, and they can't come to me because, you know, they're also under restrictions. Now, many of us are living under these kind of restrictions right now. It's particularly difficult for me this weekend because it's my mum's birthday today. Happy birthday if you're watching. And we're all struggling with that, and that applies to in parts of England. So if you live in Manchester just now, you have restrictions on travelling outside of Manchester. So it's difficult for people to get their heads around all of that, but it's just a feature of what we're living with. So the whole travelling across the England-Scotland border or the England-Wales border is not something out of that context that we're dealing with. It's just a necessary part of what we're dealing with. And the levels that we set out today absolutely make clear that if we're having different levels of intervention in different parts of the country, then part of what comes with that often will be advice not to travel from one part of the country to the other. None of this is ideal. None of this we would ever choose to do if we weren't living through a global pandemic. But we are, and therefore we have to behave in a way that keeps it as under control as we possibly can.
Just to add to that, the number of levels is because we want to try to plan for everything. And I think that's absolutely clinically the right thing to do under the circumstances. Again, the number of levels that we have and the fact that we have more levels is, as the First Minister said earlier, because we want to be proportionate. We want to target as granular a way as we can, because we don't want to put people under any kind of protective measures, restrictions that don't really need to be there. So that necessitates then potentially having more levels. We have tried, and one of the things that has come up in the discussions about the strategic document internally, to parallel the tiers that exist in England to make it easier for people to comprehend. So where we can parallel those and align those, we have, because we do understand that that will be helpful for people. But in the end, our duty is to the people of Scotland. We have to do our best by them, and that's why we have to make this as targeted as possible, and that means it is as individualised as possible, and that means that we can't always draw complete parallels with anywhere else in the UK or anywhere else abroad for that matter. And that's really the reasoning behind it. And I feel, again, clinically that's really important because we are aware of the impact that being in these different levels will have on people.
Lucy White from BBC.
Hi there, First Minister. Forgive me if you mentioned this, but just to clarify exactly when you'll let people know what level they're going to be in, and will this always be done by Health Board? And secondly, if you don't mind, there's been some concern around Professor Jason Leach appearing to criticise a tweet by the Labour leader, and the Chief Medical Officer has also criticised media coverage. So do you have any concerns about the politicisation of the civil service in this pandemic?
I'll come on to that very briefly in a moment, because I think we've actually got bigger things to talk about. But your first questions, which are really important in terms of when we will give the decisions on the initial application of this levels framework. Obviously, I want Parliament to approve the framework first, and then over the course of next week, so Parliament hopefully will endorse it on Tuesday, and then in the days following that, we will set out not just the decisions about which parts of the country go into what level, but also the rationale for those decisions, and that will be based on consultation with local authorities, with public health directors, and we will take advice from clinical advisors and through the National Incident Management Team. And the second part of that first part of your question, which is also important, which I possibly should have made clear in the outset, we envisage that the building blocks for these decisions will be local authority areas rather than health boards. Now, it sometimes may be clusters of local authorities within particular health boards that are all at the same level, but partly for reasons of democratic accountability, but partly because I think people generally understand more. They might not understand it perfectly, understand more about what local authority they live in, easier than they understand what health board area they live in or what the boundaries of those are. So local authorities are intended to be the building blocks. We will have the ability, should the evidence point us in this direction, to go beneath local authority levels and have restrictions applying in only parts of local authorities. But we always have to balance this differentiation with understandability. And so that's one of the things that we have to factor in. But local authorities will be the foundation building block of it. Look, on Jason and Greg, I don't worry about the politicisation of the civil service. We're living in unique times at the moment. Jason Leach is the National Clinical Director. Yeah, he's a civil servant, but I think it's important. I think it has been hugely important, and I think the majority of people have really valued Jason's advice, straight-talking advice at times over the past 7 months, and I think he's done an excellent job. Gregor too, and the advice that Gregor with his Deputy Chief Medical Officers, including Nicola, give us, it's an invaluable part of this process. Of course, civil servants shouldn't get involved in political debate, and by and large, and this is a part of this rule as well, politicians shouldn't have a go at civil servants, and I think that's an important principle for us to remember. I'd say this, the media have a crucial role to do right now and are playing a vital part. If I didn't believe that, I wouldn't stand here every day answering your questions. I think it's a really crucial part, both of explaining to the public what we want them to do, but also an important part of accountability and scrutiny. This bit, though, I say, and I won't overstate it, but everybody's finding this really difficult just now. Everybody watching is finding this difficult. Every person and business across the country is finding this difficult. And all I'm going to say is that applies to people advising government as well. Some of these advisors that I rely on are working incredibly long hours under intense pressure, knowing that the advice they give me that leads to the decisions I take, are matters of life and death just now. They're doing a good job, but it's not easy. And journalists are doing a good job under high pressure as well. And as I say, performing that vital role. So when I talk to the general population about us all maybe needing to be kind to each other and understand why we're all maybe getting a bit cranky at the moment. Maybe it should apply to government and to advisors and to journalists as well. We've all got jobs to do in this really difficult set of circumstances. Let's all do them to the best of our ability. Let's respect each other's jobs and the roles we are playing. But remember that nobody's finding this easy right now. And just all remember that we'll all be struggling in our own ways. Peter Smith from ITN.
Thank you very much, First Minister. At the start of October, the World Health Organization urged countries to move away from these kind of lockdown measures and focus more on eradicating the virus within borders. One of the problems that we have, of course, and we've seen after we brought the numbers down, is that we have open borders still, and that when we open up again our society, the viral levels spread again, and there'll be many people concerned that we're going to make a tremendous sacrifice through winter, only for the virus to spread yet again, and this will be a perpetual cycle. Have you asked the Prime Minister at any stage to consider closing the borders for international travels for a period until we can eradicate the virus within our borders? And just a second question, you mentioned the vaccine. There's also concern today, people are saying that the vaccine may not be the cure that we're hoping for and maybe more similar to the flu. So how does that impact your plans?
I'll let Nicola maybe substantially answer the question on vaccines, since she's more qualified than I am to do it. Let me firstly agree with the premise of the first part of your question. This is a virus that obviously travels across borders very easily, and I suspect over the summer we did get very close to elimination in Scotland, and then not entirely, but we've reseeded it from travel across the UK and internationally. So border control, I think, is an important consideration here. There are ongoing discussions with the UK government about border control internationally, and also more recently we've been trying to have discussions about how we coordinate our messages on travel within the UK. We have restrictions in terms of people coming into the country from higher risk countries, and that of course is quarantine. Some countries, New Zealand, Australia for example, have taken a much tighter approach to effectively just closing their border. There is questions even for those countries though, how long can that go on, because that doesn't come without a cost and a price to trade and to our economy and to how we all live our lives. And so none, even countries that choose to go down that road, are not getting off scot-free with this, because there are costs and consequences from all of this. But it is a legitimate question that I think we have to continue to consider as part of our overall approach. But if, you know, and it's again comes back to balances. If we were to decide tomorrow we're just going to seal off the whole of the UK, and of course one of the issues for Scotland and Wales is that we are largely dependent, not just because of where powers lie, but because of the borders between our different countries, that there are interdependencies there. But even if we decided to do that, that would then become a question of how long do you do that before people are saying, no, let's go back to having some, you know, restrictions domestically and open up again. There are always trade-offs here, but the premise of your question, I think, is an important one that requires ongoing, very serious consideration. On vaccine, I'm choosing to be an optimist on a vaccine from a non-clinical, non-scientific perspective until somebody gives me good reason not to be. I think everything I've heard suggests that there is reason to be optimistic, but not to be overly optimistic either about the speed at which we might be able to vaccinate large numbers of people, or yet, before we know what kind of vaccine it will be, exactly what the effect of that will be. And so we have to retain a degree of caution until we've got answers to those questions. But Nicola can talk about that in much more detail than I can.
Thank you. So as far as a vaccine goes, we have never known whether a vaccine, if and when it comes, is going to provide a high level of protection. No vaccines provide 100% protection. We're aware that there are still uncertainties with this, and that's just the space that we're in. So in honesty, we don't know yet the level of protection that any of the vaccines may offer. We also don't know the level of protection that natural immunity to people who have been exposed to COVID through infection has. So that is another element where there is still much more to come. Having said that, we will be guided in terms of the effect that a vaccine is likely to have by the evidence as it comes out from the phase 3 trials and beyond for the various vaccines that are available. We will also be guided, if and when a vaccine programme comes into use, in terms of our own epidemiology following that. We will obviously have a population level monitoring programme that will continue, and we will be able to see a population impact of any vaccine. So I think given that uncertainty and the fact that we will need to continue to monitor this when a vaccine comes, we will move cautiously, as we are moving cautiously now, both up and down in terms of the levels of protection that we think people need to have to keep them safe. But to put it in context, 6 months ago, we didn't have any prospect at that stage of anything to do with the vaccine. So this is, I think, hopeful. And a vaccine is not the only thing that we have in the armoury against COVID. There are also hopes for other additional treatments for COVID, and we've already had successes with treatments for COVID, such as dexamethasone. So there are other things in the mix too, and we will adapt. It's a whole package approach. Vaccine is part of it, but whatever protection it does give us, we will adapt accordingly and adapt our strategies accordingly to protect people as best we can. I'm a realistic optimist, is what I would say. I'm not actually an optimist by nature. But I think in these circumstances, we have to try to be hopeful about things. So I am optimistic that a vaccine will come, but I'm not going to pretend that I think it will be 100% protection. But what I will say is that any protection that we get for our population with a vaccination programme is going to be a fantastic thing and a great tool in our armoury.
Fraser.
My specific question was, have you asked the Prime Minister to consider closing the borders yet?
We have ongoing discussions. I'm not going the discussions we have will encompass a range of things. I have not had a specific discussion with Boris Johnson that focuses on that particular point, but there's a range of discussions across a spectrum of things that happen between the Scottish Government and other governments across the UK on an ongoing basis. Fraser Knight from Global.
Minister, under the socialising part of your strategic framework, the rule of 6 is in place right down to level 1, and even at level 2, no in-home socialising is allowed. Could we be in a position come Christmas where some areas in level 1 will be allowed to have people from 2 households around the Christmas table, but people living in level 2 might not be allowed to have that? And just one perhaps for the Deputy Chief Medical Officer, under the shielding advice, the First Minister said that the central belt just now could be described as similar to the level 3 restrictions. And on the shielding advice, it says parents or guardians of children should discuss with their GPs or clinicians whether children should still go to school. Do you perhaps think that schools at the moment in the central belt, children who are going to them, their parents should be discussing whether their children are in class or not?
I'll hand over to Nicola in a sec. Look, I'm not going to start talking specifically about Christmas today because we cannot know for certain at this stage what the conditions will be at Christmas. What we do know is that the more we act now to get the virus coming down, the more normality we might be able to have by Christmas. And that's basically the most certain thing I can say right now. I want us to have more, not less normality by Christmas. It won't be 100% normality, but that depends on all of us. And that, I think, should be what we bear in mind. The second point, though, which is not specific to Christmas, it's a general point, but it stands to reason. And this is a point people, I'm asking people to understand because it is very much at the heart of this new approach. And it's a deliberate trade-off we are proposing to make. If we have an approach that allows for different restrictions in different parts of the country, then it stands to reason that at some points, some people will be operating under more severe restrictions than other people. Now, as it happens, we have a nationwide restriction on going into other people's house just now. But if you live in Glasgow right now, you can't go to the pub, whereas if you live in the Highlands, hospitality is restricted, but not restricted to that extent. So we already have that to some degree. And that is just an inevitable consequence of not having a one-size-fits-all approach. Now, I think that is better because it means we're not putting people under restrictions when they don't really have to be under them. But of course, it leads to people then thinking, well, that's not very fair. Why am I not able to go and see my family when somebody living in a different part of the country might be? But the alternative to that is somebody living in an area with very low rates of the virus ends up being restricted in order to suppress it in the other side of the country. So there's no perfect solution here. I think that's one of the things I regrettably and very reluctantly came to terms with earlier on in handling this pandemic. There is no perfect solution. Every approach we take, somebody can, with a great degree of legitimacy, say we should do it the opposite way. There's no absolute rights and wrongs. We're trying to strike the right balance and be as proportionate as possible. But when we do it that way, inevitably we create the conditions where some people are in and some people are out. The alternative to that is just to have everybody under the same restrictions, even if it's not justified in their area, which brings with it its own inequities and unfairnesses. Nicola.
Yes, on the Christmas front, I don't think any of us know for certain what's going to happen in terms of how the protective measures might be around Christmas time. What we do know is that what happens now and what we do now is what will influence that. And if we can get the virus under better control over the next number of weeks, then we all stand the best possible chance of having as normal a Christmas as we are able to. And I myself am in the Central Belt under some of the most stringent protective measures at the moment. So I, again, as a person, as a human being, as someone with family and loved ones, feel that just as much as anyone else does. As far as the question about shielding goes, then the advice that's been given for the Central Belt has been considered very carefully, been given very specifically by the National Incident Management Team. When they give advice on additional protective measures or restrictions for specific areas, they do also consider at that time whether any additional guidance needs to be given for people who are shielding. And so whatever advice has been given out at that time, I think is entirely appropriate. That will have been considered. And although the restrictions that are in the Central Belt at the moment are similar to the levels that we've spoken about in the new strategic document, they may not be absolutely identical. So I think there are going to be some slight differences because the restrictions in the Central Belt have been set up specifically for that particular situation at the moment. So the short answer to your question is no, I don't think anyone in the Central Belt needs to do anything different at the moment. Obviously, if parents do have particular concerns for individual children who may be extremely at risk, I mean, every individual case is different, then they shouldn't hesitate to speak to their general practitioner if they are concerned. But the advice as it is on a general scale would stand.
Thanks. Natasha Richardson from Bauer.
Thank you, First Minister. NHS Lanarkshire says its hospitals are at 90% capacity and non-essential surgery has also had to be cancelled at Monklands. Are there discussions yet about bringing the Louisa Jordan into action to ease pressure on NHS Lanarkshire, or is there a sort of higher capacity level or trigger point that needs to be met first?
These decisions are, these considerations are ongoing all of the time, and we will review on a regular basis whether we need the Louisa Jordan for COVID. Obviously, the Louisa Jordan is doing other things just now, but all health boards have their own surge capacity, both in terms of hospital beds and in particular in terms of ICU. Across Scotland, there is the ability to double ICU capacity within a week and then to take it significantly above that afterwards. But these are issues are the subject of daily discussion between Scottish Government and individual health boards. We are worried about Lanarkshire. I said that yesterday. I think it's the National Incident Management Team is considering the situation in Lanarkshire over the course of today. Cases have been rising there quite sharply, and we do see, as the health board has said in the last couple of days, significant pressure on intensive care. They're coping with that pressure, but it is, it illustrates the point we make here. We cannot allow this virus to run unchecked out of control, because what happens is our NHS comes under that kind of pressure, and inevitably that means that other procedures and consultations have to be postponed, and that creates its own health problems. So that is another reason why we have to act, all of us, in a way that keeps the virus under control or gets it back under control when it is rising.
Just to add to that, we do always have contingency plans in place. We are in close contact with all of our health boards, and we work with them to make sure that they have their own individual surge plans, as the First Minister has said, but also to make sure that mutual aid across NHS boards exist, as well then as our further contingency planning with centres like Louisa Jordan. And as the First Minister says, this is exactly why we need this strategic document and potentially different levels of protective measures across Scotland. Because when we see one board with cases rising, if other boards are in the position to provide mutual aid, then that's great. But if we all end up in the same position and all the boards are in the same position, for example, as Lanarkshire, then there's no mutual aid to give. And that's when we run into real problems and real risks of the NHS being overwhelmed. But by being able to put in these proportionate protective measures in different areas, so where incidence is higher, we can then try to bring that down, whilst also allowing other places which are not necessarily yet in that stage to function as normal. We allow that mutual aid to be able to continue to contribute to our capacity. So we don't take this lightly, of course we don't, and it's a warning sign for all of us as to what could happen if we don't act in the way that we're acting currently.
Katrine Bussey from PA.
Hello, First Minister. I had some questions about when we'll find out what level of restrictions businesses and people are going to have to live with. You said that would happen after Parliament hopefully approves the framework on Tuesday. Do you anticipate there will be one big announcement that sets out the level of restrictions for all 32 local authorities in Scotland, or will it be more of a sort of a rolling situation like we've seen in England? And also, do you anticipate any local authorities, perhaps some of the more rural island authorities, could go straight into level 1 or even level 0? And conversely, could any local authorities go straight into level 4, the most severe level of restrictions?
Okay, thanks, Katrine. Look, in general terms, all of these things are possible, but none of them might happen. So, you know, I'm not going to get ahead of the assessment and decision-making process and start to speculate about what areas might be in what categories. What I can say is right now, you know, the central belt is in what would be the equivalent of level 3, and the rest of the country is in what would be the equivalent of level 2. But decisions on whether any go down, and this kind of approach does open up the possibility for islands or the Highlands or more remote parts of the country with low levels having a much lower level. But whether that would be 1 or 0 or 2, that decision is yet to be made. In terms of your specific question about the nature of the announcement, I would anticipate that the initial application of this framework, we will do that in one go and announce that at once, because this is for the first time assigning a level to all parts of the country. We will then review on a weekly basis. That doesn't mean there will be changes on a weekly basis, but depending on what's happening, there are parts of the country that could go down a level or up a level. And I suppose broadly similar to what we do currently with international travel, of deciding countries that are in and out of the quarantine arrangements. Obviously, between now and then, if we had to act more quickly in terms of putting a part of the country into a higher level, we would do that if we thought it was necessary. So I'm not ruling that out, but in all likelihood, we will set this out as one package next week after Parliament has had the opportunity to vote. And yeah, beyond that, I just don't think it is possible for me to say, are parts of the country going to be in 4 or are any parts of the country going to go down to 1 or 0, because that assessment has to be done based on the most up-to-date data that we have.
Just to add one thing to that, really, which is that for those of you who haven't managed yet to read the whole of the strategic document, there is a section in it which gives some indication on how the decision as to which level local authorities will be assigned is made, and that includes a number of indicators, so 5 indicators relating to the most up-to-date data that we have, which includes the number of cases, the modelling future number of cases, the percentage positive cases we have for the tests that are done in that area, the capacity that hospitals in that area have, and also the ICU capacity that that area has. So if people are interested, they can read more about how some of those decisions will be made. It's all there again for transparency and for absolute clarity. But as the First Minister says, that needs the up-to-date information. So that's why that decision will be made with the most recent information that we have for each local authority when the time comes.
Vivian Aitken from the Daily Record.
First Minister, just following on from that briefly, if I could ask, if somebody is in level 4 1 week, could they then go down to level 1 the following week, or would it be a graded thing that go from 4 to 3 to 2 to 1 till everything was normal? And if I can also separately ask the Chief Medical Officer on a point that she made about reinfection levels with the vaccine. We know at the moment that very few people seem to be getting reinfected, but we do know that in some cases the infection is lying dormant and then can come back. The same virus can come back in the same person, very often more serious the next time they're infected. But can you tell us, during this period that the virus is dormant, are people still infectious? And if so, should we actually be testing people at the end of their virus as well to check that they're clear of it?
Nicola is certainly the one that can answer the second part of that question. I'll have a very brief go at the first part. Although we will review this every week, I want to caution against an idea that every part of the country will move on a weekly basis. Let me illustrate this with an example. If a part of the country or even the whole country at any stage was to go into level 4, in order for that to have an impact, while we would want that to be for a short period, it is likely to be for 2 to 4 weeks because of the life cycle of the virus. And after that, while it is, I suppose, theoretically possible, you could go from level 4 to level 2, I think it is more likely that it would come down in a sort of graduated phase way, rather than going from 4 to the very bottom level. So we would review this every week, but once a part of the country is in a level, if that is level 3 or 4, 2, 3 or 4, while we want that to be short, it is likely to be for more than a week. Levels 0 and 1, we hope we can get the whole country or as much of the country into as possible, and then be in those levels for as long as possible, because these are the levels at which we deem the virus is most under control, and therefore restrictions can be lifted on a more sustainable basis.
So just to add to that, I think it's highly unlikely that we'll ever go from level 4 to level 1 in an area in a week. I'd love to be proved wrong, but given the incubation period of the virus and the fact that it takes more than one incubation period, if you like, of the virus, so more than 2 weeks for us to see the impact of any protective measures that we put in, I think that's extremely unlikely, and it's more likely to go from one level to the other in both directions for local authorities. On the question of reinfection, so there have been cases of reinfection reported in the literature on a worldwide basis. These haven't been reported very frequently, but partly that's to do with being able to define absolute certainty what reinfection is and that it's occurred. And so the cases that have been reported have been people who've had symptoms, had a positive test, have then subsequently resolved their symptoms, tested negative, have then got symptoms again, another positive test. And that is pretty much the definition of definite reinfection. And as I say, that does seem to happen, not terribly commonly. But in those cases of actual reinfection, it does not necessarily, it's not usually the same virus as they had the first time. So I want to, at the moment, I think, dispel that notion that the virus lies dormant in people and then reactivates itself. That's not what the science is telling us at the moment, and I'm not quite sure where that's come from. What we can see is when people are recovering from COVID, that they may get symptoms which come and go, symptoms which wax and wane, and sometimes over a period of weeks. And actually that's not uncommon. We can even see people who have symptoms that persist beyond 3 weeks, and there's ongoing work on that with various definitions and guidelines for so-called long COVID, which will come out in the future. What we do see when people start to recover from COVID, if you continuously test them every single day, there will be the occasional time where they might test negative, they might test positive the next day, test negative the next day. That may be what you're talking about when you talk about the virus being dormant. And just to be clear, that doesn't mean that the virus is in their system and reactivating. What that means is, as we talked about our tests before, sometimes they pick up tiny levels of non-viable, non-functioning, dead virus as people are recovering. And because our tests aren't perfect, sometimes they will pick up those very low levels as people are recovering, sometimes they won't. And it's that sort of blipping that we see if you monitor people for a long period who've had COVID, but it doesn't mean that they are infectious. It doesn't mean that they have dormant virus that has reactivated. We know that the vast majority of people are not infectious after 10 days of their first positive COVID test, and that's why our isolation period lasts that long. So asymptomatic infection happens. It happens in a first case of COVID. It may happen in a reinfection with COVID, but it's not a dormant infection that then just reactivates in people, just to make that clear. Thank you.
Thank you. Daniel Sanderson from the Daily Telegraph.
Thank you, First Minister. Yeah, I just wanted to check something on the travel section of the framework. Under level 4, it says that if necessary, there could be a requirement to stay at home. It was just that word requirement rather than advice. Does that mean a sort of legally enforceable thing, which we've seen in other countries where, you know, people have to potentially, obviously there would be exemptions, but people have to justify why they're out of the house, or would it just be advice? And also, secondly, I mean, there are obviously 32 different council areas in Scotland. You've even said potentially there could be different rules in a different council area, which, you know, I understand makes sense for the larger ones. But how are you going to make sure that the public is aware of what level they're in and what restriction apply? Not everyone watches these briefings or watches the news or gets a newspaper every day. So for those people, how are you going to make sure that they know what level they're in and that they're sticking to the rules? Thanks. On
the latter part of that question, there's no perfect answer. We do that in a multitude of different ways. These briefings are part of it. Our polling would suggest this briefing is still where the biggest percentage of people say that they get their information from. It won't necessarily be people watching it live, but maybe catching up on it later. We use social media, we use paid for advertising on television and in other parts of the media. So we use every possible mechanism and means we can to get these messages across. It's not perfect. We like to think that the media, newspapers and broadcast media will absolutely scrutinise the messages as they go, but help us in making sure at least there is an understanding of the factual information that we're asking people to absorb. There's no doubt when you move away from a one-size-fits-all approach, it gets more difficult, just as when we started, and I'll segue into the next part of your question with this, when we moved from a very straightforward stay-at-home rule in the earlier lockdown to, well, you can do this but you can't do that, it just gets more complicated. But I'm afraid that's the price of greater freedom and flexibility and not having a very severe one-size-fits-all approach. But it's not easy and it's not straightforward for anyone. On the first part of your question, I wouldn't read too much into the particular word we've used there. It could be either. It could be advice or it could be more legally stipulated. As in lockdown, there was I'll be corrected if I'm getting my memory wrong here, but stay at home was a legal requirement apart from in certain circumstances in the earlier part of lockdown. If we thought that was necessary, we'd do it, but it may be just a general piece of advice to people, strong advice to people in these circumstances to stay at home. Wales, as of tonight, is going back to a stay-at-home message for the next 2 weeks. I hope we don't have to go there, but this document is about looking at all possible scenarios so that people have an understanding and clarity, or as much clarity as possible, of what might be required in certain circumstances. Alistair Grant from the Herald.
Hi there, thanks very much. You've obviously said the intention is to keep schools open at all levels. Could you maybe outline what schools might look like under level 4, what changes pupils and parents could expect? Will there be any noticeable difference for them?
My objective, and when I say this, please don't assume it means I'm not concerned about the safety of schools. Of course, I take that as read. The safety of children, young people, teachers, everybody in a school environment is absolutely essential. But by and large, what we are trying to do here, and it is one of the reasons why we will sometimes have to put greater restrictions on in other parts of life, is we want schools to be as normal as possible. So I would want, if possible, for us to have schools continuing as they are just now, with all of the measures that are in place just now around face coverings in certain circumstances, hygiene, ventilation, all of that, but schools to carry on pretty much as they are now. We recognise on a school-by-school basis there may be circumstances where, because of the numbers of pupils or staff in a school who have COVID, or the fact that there's very, very high transmission rates in a particular area or a local outbreak, then for a period of time there may be school-by-school exceptions to that. But as far as possible, I want children and young people to have, as normal as possible, a school experience, because that is overwhelmingly in their best interests. And so if that means the rest of us sometimes have to put up with a few more restrictions, that is one of the reasons why, so that we can allow kids to have as much normality in their school experience right now as possible. Do you want to add?
Just just to add briefly, we do have an education recovery group within government, and we have a scientific element to that education recovery group. And to add that we will always be guided by the evidence. And so that will be evidence about the school environment and what risks that may pose. Also, if the evidence changes in terms of age ranges and risks of transmission. So we will try to keep things as least restrictive as possible, as the First Minister said, when it comes to schools, even at those highest levels, but we'll always be guided by the evidence and the clinical data that's available to us.
Chris Wilson from The Sun.
Good afternoon, First Minister, Dr. Steedman. Just on the different rules in different areas and how they'll be enforced if necessary. As council areas move between these levels, are the rules like on gatherings or household mixing, are they going to be set down in regulations? And also, you probably won't be surprised to hear that on social media already people are saying that given you're talking about a 5-level plan, 1 to 5 might have been simpler to understand rather than 0 to 4. So just to check, why did you go with 0 to 4 rather than 1 to 5 when you're talking about 5 levels?
Yeah, that's a good question. We started out the reason we went 0 is we intend it to be seen as a baseline, as close to normal as you can get without a vaccine. And we started off in our earlier consideration of this, which feels like a lifetime ago, but it's probably only the start of the week or last weekend, with a baseline 1, 2, 3, and then I think we had 3 plus. We were trying to keep 1, 2, 3 broadly equivalent with England's 1, 2, 3, to be frank, and that's part of the consideration as well. I'm not particularly fixed on it. I'll be honest, as I've been reading it through, I've had that same question in my mind as I've been explaining it today. Would it be just simpler to say 1, 2, 3, 4 and 5? That maybe, if there is a view, that would be easier for people to understand. I have no particular fixation on the sequence of numbers that we use. So if that was the view put forward, that is probably one of the simpler amendments we could make before Parliament debates it on Tuesday. We did have when I met with the party leaders earlier on, we did have a very brief discussion about that, and I think that's what moved us away from 3 plus to 4. So we'll see if there is a view of that. On the first part of your question, which is important as well, it will be, and I know this is a general answer which will be populated by more detail as we go through the next few weeks. It will be a mixture of guidance and regulations, as it always has been, even during the most severe period of lockdown. Some of the rules were in law and therefore backed by enforcement, and other aspects were in guidance where we were asking people to do things, but it wasn't legally mandated, and there were no penalties if people didn't do it. So we try to, again, reach a balance on things. There are some things that, even if you put them in law, are difficult practically to enforce. So we just, sort of come down on the side of guidance. There are other things where if people breach the rules, the consequences of that are so serious that it needs to be understood that there is some penalty for that. So it's not an absolute, I wish it was in all of these things, it's not an absolute science. We try to make these judgments as we go. And as you know, as we have gone through the past 7 months, some things that started out in guidance have been translated into law, face coverings, for example, because we recognise we needed to have the potential for enforcement with penalties if people were just flagrantly breaching that. So these are judgments we'll continue to make as best we can. Rachel Watson from the Daily Mail.
Thank you, First Minister. Just to go back to the point on local authority areas, you spoke earlier about going beneath those when enforcing restrictions or putting people in and out of tiers. How far beneath local authority area could that be? Kind of what areas are you talking about? Villages, towns, for example? And also, does having so many different levels across so many different potential areas, does that make these new restrictions more open to abuse, for example, so people could flout them easier and plead confusion or things like that? Are you worried about that, for instance?
If you start to take these decisions on the assumption that everybody's going to breach them, then you're off to a pretty bad start. Yes, compliance and the possibility of enforcement are always part of this, but in my experience, based on the people I interact with in my life, the vast numbers of people that contact me on a daily, weekly basis, the vast majority of people want to do the right thing, and therefore the important thing is to get the information across to them as clearly as possible, recognising the complexities that there are. I think it was in the English version of your paper today, Rachel, there's a headline that says that the rule against mixing in households doesn't work. The small print is if people don't abide by it. Well, that's true of any rule. If people don't abide by it, it doesn't work. I think the onus on all of us should be to say, if you do abide by it, this will work and this is the effect that it will have. So that's the approach that I choose to come at it from. On the first part of your question, again, very important, legitimate question. I suppose the answer, though, and I'm not trying to sort of almost be too clever by half in answering it here, it can go as long, in theory it could go as low as you want it to, but in practice you have some considerations that you've got to weigh into the balance, and part of that will be the nature of the area. So if I think about where I live in Glasgow, the council ward I live in, putting restrictions just on it, given the interrelationships between it and the next door ward, would probably not make sense. In the Highlands, that might be a different consideration, because the distance between towns or council wards is so much greater that it might be more practical to have restrictions for a town that didn't go across the whole council area. So these will be often quite practical considerations, as well as what the clinical advice says is needed. And then overlaying all of that, we just have to make judgments about how differentiated is it possible to get and still have any hope that people can understand what they're supposed to do. So in all of these decisions we're making right now, there's a multitude of factors that we have to weigh into the balance, a multitude of trade-offs, and get to the best decisions we can that we deem have the best chance of pulling back the virus. So it's not as straightforward as that when we actually try to apply this in practice. I often wish it was. Do you want to add?
Only very briefly to say that, as before, we're going to try to be proportionate. That is what we always want to do. We don't want to have to restrict people any more than is absolutely necessary, because we know the hardships that causes. So I think we would try to get down to as granular a level of restrictions within an area as is possible. But as you say, that isn't always easy, and there will be practicalities to take into account, because people may interact across granular boundaries that mean it just doesn't make any sense to bring a restriction down as small as in the ideal world we might like to be able to do. So I think the message is we will take it down to the lowest level that we can, because that's what we want for people. As far as people gaming, if you like, and saying they're confused so that they're not abiding by the advice, we have to trust people. And as a physician, I have to trust patients to hear my advice, to listen to my advice, and then to make the right decision. And people are adults are grown-ups, and they are intelligent enough, and I hope that we give them enough information to make the right decisions. But this is an individual and a collective endeavour, and we do have to work together and trust people to work together in order to help all of us in the end.
Thanks. And the penultimate question today is Scott McNabb from the Scotsman.
Thank you, First Minister. On the review of testing, which was published earlier today, it estimates that 54,000 tests a day will be the demand by December. That's almost double where we are just now, although you say capacity is estimated to increase to about 65,000. But the report also talks about prioritising certain groups, so care home staff, NHS workers, the groups you actually, I think, announced earlier will get additional testing. But if we reach a situation where demand outstrips capacity available, is there a government scenario planning in place which would prioritise certain groups over others, such as, for example, younger Scots with no underlying health conditions? Thank you.
Symptomatic patients will always be, symptomatic people rather, will always be the priority, because they're the ones that are most likely to have COVID, and therefore we need to get positive tests. Can I say, and your question is perfectly valid, because when we do the modelling, we're making assumptions. So, but we are, the modelling that's been done, we have been sort of cautious to the point of underestimating what we think our capacity will be, and we've been cautious in the other way in estimating our demand. So we've probably slightly overestimated what we think demand will be from symptomatic people. It will rise over the winter. That doesn't necessarily mean the number of people with COVID will rise. Hopefully it won't. But as we go into the winter period, more people will have the symptoms of COVID because they might have other viruses that result in those symptoms. So if you've got a cold or the flu, you will probably have one of the symptoms of COVID and you'll be coming forward for COVID testing. That's why we estimate that the demand for symptomatic testing will rise. Now we have, we've been very generous in our estimates of that so that we're not underestimating that, and we're being very, very sort of cautious in our estimate of demand, of capacity. So we are hopeful, as well as you can be, that we won't run into that scenario. But if we did, it would be the symptomatic people that we would prioritise, followed as we are doing right now with testing asymptomatic people for the protection of those most vulnerable to COVID.
So it's clear in the revision of our testing strategy that the two main priorities going forward are symptomatic demand, and that's in order to break chains of transmission and to control transmission of the virus overall. And the scientific advice has been that needs to be prioritised, and also testing to support the clinical care of patients in hospitals, for example. So if you want to know what the big priorities are, it's very clearly stated in the testing strategy that that's what those are. In terms of extra capacity that we might have, again, it's clear in the strategy what the priorities would be if we do have that bit of extra capacity in the system, and that's protecting the vulnerable with potentially testing staff that come into care homes on an infrequent basis, testing care home visitors, increasing healthcare worker testing more broadly, and testing care at home staff. So when we get beyond that, then that's when, if we continue to have increased capacity, we move towards more asymptomatic testing. So those prioritisations based on clinical priorities and scientific advice are very clearly laid out. And what I will say is that we model the capacity and the demand on an incredibly frequent basis. So yes, it is modelling, absolutely, but because there are uncertainties in it, it's monitored extremely frequently, and that's another one of the recommendations that is actually stated within the revised testing strategy, that's an essential part of our testing planning as we move forwards.
Thanks. And the last question today is Derek Healy from the Courier.
Thank you, First Minister. I just wanted to pick back up on that point about a vaccine. You said in your introductory remarks that the lowest level of the framework would broadly resemble where we were in the summer. But even at that point, we did still have some restrictions and guidelines in place, and from the framework, it looks as if that could still be the case. So do you expect that there won't be a return to a pre-COVID normal without a vaccine? And I appreciate you want to be an optimist, but in practice, if that does take a very long time, does that mean kind of level zero is the kind of best hope during that period?
I'm just going to be a realist, and from a non-clinical perspective, Nicola can give you a much more clinical answer to this. We've got a global pandemic of a virus. Without treatment or a vaccine, it's not just suddenly going to disappear, and none of us have got a magic wand to make it. So yes, until we get to the scientific solutions to this virus, which I am optimistic about with all the caveats you heard from Nicola earlier on, we will have to defeat it in other ways, or keep it under control in other ways, and that comes down to human behaviour. And the challenge for us is to find ways of doing that, which includes test and protect and all of the other things that we are doing in a way that involves as few restrictions as possible. But for me to stand here and say that this side of a vaccine or a much more effective treatment, we're going to go back to 100% normality. Nicola used this phrase in another context earlier on. I would love to be proved wrong on this. I'd love nothing more, but I don't think that's realistic in a global pandemic. So that's just the reality. But do I think we can get to a much lower level of restrictions than we are operating under right now? Yes, if we do all the right things, if we continue to make sure testing and self-isolation is helping break these chains of transmission, we can, but it will take all of us playing our full part. Nicola?
Will we go back to normal without a vaccine? We don't know is the answer. there are other strategies, as we've outlined today, including better treatments. There are also possibilities, of course, that when people get COVID, some kind of immunity will be provided. Again, we just still don't know that at this stage, and more work is ongoing. So there are lots of ways where life can go back to normal that involve vaccines or don't involve vaccines. And it's still very much unknown. The virus itself might change over time. That can happen with other viruses, that they mutate so that they become less harmful to humans. We just don't know some of this yet, and that's why we need the ongoing work and the ongoing science to inform us. So again, realistic optimism. This will not last forever. Pandemics do come through populations and they don't last forever. Something happens, a vaccine happens, a treatment happens, the virus changes or the human response changes to it. Sometimes any combination of those. We just don't quite know when some of those things might come. We do know that we're still very hopeful about vaccines coming in the near future. And I think that's why people are still very much concentrating on those as being what we hope will be a really important part of this. But they are not the only way to get out of this.
Thank you, Nicola. Thanks to all the journalists who asked questions today. Thanks to Yvonne for doing our BSL interpretation in what was a mammoth session for you today, and my thanks to Nicola for providing the clinical expertise in answering these questions. Please take the time to have a look at the framework we've published today. We will be listening to views over the next few days before Parliament considers it on Tuesday, and we'll make changes if we think that is needed, from the presentational to if we decide to call it 1, 2, 3, 4, 5 as opposed to 0, 1, 2, 3, 4. That's, you know, we're open to that. But more substantively, from businesses in particular, if they want to make a case for something different happening at different levels. We can't promise that we can accommodate every request that is made because we have to keep the virus suppressed, but we will listen. And I want to end on an optimistic note, which may seem a bit, I don't know, a bit out of kilter with everything we're living through right now, but I think it's important. The figures I gave you at the start of my remarks, please don't allow them to be overshadowed with all of the other important things we're announcing today. Everything we're doing right now, we think is having an impact, and if we keep doing it, it will have a greater impact. And we don't just need to look at the figures just now to know that. We know that these things made an impact in the summer, so we can get this virus back to low levels, and then we can start to ease some of these restrictions again. It's not easy, and it is much, much harder 7 months in than it was at the outset. But of course, we're not back where we were at the outset. We're not in strict lockdown, and we have many more tools in our arsenal, not least Test and Protect, which is working really hard every single day to try to break the chains of transmission when people test positive. So let's keep optimistic, let's keep looking out for each other, and let's keep acting, all of us, in a way that is designed to beat the virus. We all have our disagreements. That's natural. Every time in any country we have disagreements, we have disputes, we have different opinions and a whole host of things, and that's all fine and doesn't go away in a pandemic. But the one thing that changes in a pandemic is that we have a common enemy, and that common enemy is COVID. And if we all act together to defeat it, then we can hopefully make that journey back to normality more quickly than will otherwise be the case. So please keep abiding by all of the rules, all of the guidance, particularly facts when you're out and about. And remember, this is all about keeping ourselves safe, it's about keeping the people we love safe, it's about protecting our NHS, and it is about saving lives. Thank you all very much indeed. We'll be back here on Monday at the usual time, and I look forward to seeing you then. Thank you.